Good morning, magandang gabi. Philippines, magandang gabi. Good morning. US, Canada. 5:36 AM. Kumusta po ang lahat? Ready na ba tayo mag-Q&A? Today meron tayong special na pag-uusapan, something that happened to me recently. Some of you may already know na recently po nagkaroon ako ng COVID. So, I'm going to share with you kung paano nakakatulong itong lifestyle natin na ito sa pagkakaroon ng mas matibay na immune system that can really help sa pag-combat ng COVID, how it can help, prevent yung COVID. And even if magkaroon po kayo ng COVID, how low carb and fasting can help. Dumarating na yung mga data, so dumarami na po yung research studies, yung mga data galing sa institutions like Virta Health, for example. So Virta Health, if some of you don't already know it, ito isang institution sa US kung saan they treat people for lifestyle-related medical diseases. So mainly diabetes reversal. And dyan sa center na yan, so the medical director of Virta Health is si Dr. Sarah Holberg. And dyan, they conduct a lot of studies on recently nga ito, yung what is the impact of the low carb lifestyle. So, ketogenic diet, low carb lifestyle, ano yung impact niyan doon sa mga pasyenteng nagkaroon na ng COVID. And so, I will share with you, yung ginawa ko actually yung strategy, ito recently, di ba, yun nga, sa mga late pong nakahabol, I am just discussing with you what I did sa sarili ko pong battle with COVID. I had COVID recently and yun nga po, ang talagang strategy na ginawa ko is to go fasting and also to stay low carb. Kasi we know that the virus, I think I already discussed this with you before, I believe a few months ago, na-discuss ko po sa inyo yung pathway, and actually maglalabas ako ng more official video about this, but pretty much, yung obesity. So the state of having high sugar, it really impacts yung morbidity na mangyayari kung sakaling magka-COVID kayo. So in this case, the two receptors that ginagamit ni COVID virus to go in are yung ACE2 and DPP4. And these are actually deranged in conditions like diabetes, for example, obesity. So may mga studies silang ginawa na yung mga tao who show up in the emergency room, so let's say, nagkaroon siya ng COVID and then they go to the ER, they measure yung level ng hyperglycemia, so taas ng asukal nung tao na yon. And some of these patients are not even diabetics. Yung iba talagang lang siguro, nag-sugar load sila, kumain ng high carb, tapos they showed up in the ER. Tapos, when they measured these people's blood levels, those who had really high sugar had more morbidity. Ano pong ibig sabihin nun? Sila yung mga nag-end up sa ICU, sila yung nag-end up with the ventilators, sila yung mas komplikado. And why is that? Bakit po nangyayari yan? And it's because of this. So, you see, this one, it's the inflammatory response, right? The inflammatory response, I think I have ito. So, yung inflammatory response is heightened sa mga tao. Remember, obesity by itself. So, obesity, having high blood sugar is already very much pro-inflammatory. So, syempre, idagdag pa natin dyan yung effect ng virus mismo, right? Because the virus particles also induce yung inflammation. So, ang nangyayari, it feeds on that cascade. Bakit ba maraming, number one, nagkakakomplikasyon sa COVID, number two, namamatay? It's from that inflammatory response. Yung cytokine storm na tinatawag, ito yung, yan. So the cytokine storm, I mean, this is just a graphic representation, but what it is once ma-activate kasi ng virus yung inflammatory response na yan, then yun na siya. So, and people who are, for example, obese, people who are or who have high sugar from the get-go will already be pro-inflammatory to begin with. Kasi kahit pa walang COVID, ang mga tao kasi who are obese and people who have high sugar, mas madaling ma-activate yung kanilang cytokine system, nakataas yung mga inflammation markers nila, so yung IL-8, yung mga gano'n, C-reactive protein. So these are inflammatory markers na kahit wala pang COVID, mataas yan sa mga taong high ang sugar, sa mga taong may fatty liver, sa mga taong may high cholesterol. So idagdag mo pa ngayon si COVID na nakakapagpalala pa nga ng cascades na yan, right? And then, so what do you get? So more morbidity. Kung makuha mo man siya, magkaroon ka man, mas magiging komplikado yung journey mo ng healing. Yung iba, they don't make it, right? It's from that cytokine storm. It's from that inflammatory reaction. So it's worthwhile for you to know na, let's say, like, magkaroon, wag naman sana, pero talagang hindi maiwasan, right? The Omicron is very much virulent. So magkaroon kayo niyan, then yun ang gawin po ninyo. Anong gagawin ninyo? Mag-fasting kayo. Just, starve the virus. Not yourself, but the virus. So mag-fasting, kung kakain, mag-low carb lang, and then try to fast. So that's what I did on day 1 nung na-realize ko. Kasi the week before, I saw a patient who was COVID positive. So Omicron yun. And I knew I was gonna get it. I knew kasi I've been working late recently dahil may mga tinatapos po ako sa aking business. And so I knew I was gonna get it. So the moment na na-realize ko, mag-set in na yung body aches. Hindi naman ako nagka-fever. So mainly ano lang siya, body ache lang. Then what I did was I went fasting. So nag-fast agad ako. And then, it went, the main symptoms really like lasted for 2 days. And then, nung kumain ako, I ate just really like keto. Talagang wala pang ano yun, siguro 10 grams. Less than 10 grams a day yun na net carb yung kinain ko. So sa mga bagong-bago sa lifestyle po, ano ba yun? How does it look like? So less than 10 grams. I'm just showing you yung breakdown. Sa mga bagong followers natin who have no idea how that looks like. Yan. So, yun, nung nagkaroon ng COVID, yan, nag-keto ako. Normally, I'm in the moderate range. I normally eat between 20 to 50 grams of net carb per day. So, nung nag-onset na yung COVID ko, then I went to, yan, less than 10 grams per day. So, I ate mainly meat. Meat lang yung kinain ko eh. And yun, I fasted. Fasted talaga. Like, I believe mga ano yun, siguro 20 hours or so. Yan. And then just fluids. So, it's very powerful. Try it. Sana huwag kayo magka-COVID, pero kung magka-COVID kayo, that's what you do. Don't be afraid. Huwag matatakot na mawawalan ka ng energy. Your body still has your stores, energy stores. Lalo pa po yung mga may sakit pa rin, mga diabetic pa rin who need to still lose more weight. Don't be afraid na wala kayong kakainin. Your body needs to heal by fasting. So kung abutan man po ng COVID, that's what you will do. Okay? So yun lang po. And also, from our community, we know na yung mga practitioners natin, like if you look at the different pages, yung mga different groups natin, a lot of our community members na nagka-COVID, they all report the same thing na sila ay, hindi masyadong malala yung sakit nila. Yung iba wala talagang symptoms. Kasi nga, low carb helps eh. Low carb and fasting certainly helps. Mababa ang inflammatory load kasi ng lifestyle natin. So many people don't have symptoms. Many people have mild symptoms. And we recover fast. Ang bilis ng recovery natin pag tayo ay low carber. Okay? So always remember that. Para ding cancer, no? The virus takes advantage of sugar. Super high sugar levels. The higher your sugar level is, pag tinamaan ka, mas magiging komplikado yung sakit mo ng COVID. So, the moment that you realize that you may have it, fasting ka kaagad. Just go right into the fast. Prepare your fluids, your electrolytes. May mga videos tayo about that. And just get on with it. Wait for your body to heal. Antayin mo yung natural defenses. Yung ating natural killer cells. So we have the NK cells, ano? Natural killer cells. Antiviral yan eh. So that elevates kapag mataas yung ketone bodies natin. This is why you wanna go ketogenic. The moment that ma-realize mo na may COVID ka, don't just go low carb, mag-keto ka. Less than 20 grams. Kasi ang lahat ng ketone bodies are very helpful sa pag-combat ng inflammatory cascade. And yung natural killer cells natin tataas kapag tayo ay keto. So, word of advice lang po, ano, that's exactly what I did. Okay, so ngayon, magko-questions na tayo. Magandang gabi. Good evening, Miss Val Lee. Hello from Manila. Magandang gabi, Miss Janeng Flo. I'm going to wait for your questions po. Magandang gabi, Miss Angel. Hello. Sir Christoph. Nice to see you po, sir. Hello. Thank you for watching sa YouTube, Miss Babe Palma. Hi. Sa aking country, yes. Thank you. Dito sa Canada. Good morning, Miss Ina from Winnipeg. Yes, dito rin siya sa Canada. Isa sa ating mga active community members. Thank you. Hello, Mr. Aquilino. Hello, sir. Thank you. Ito, patient ko, Jean. Good morning, Jean. Hello. Okay, from Norway. Thank you po for watching. Hello. So, let's see. Sabi ni Facebook user, we had it to Doc ni hubby last year. We were both asymptomatic, if not with our lifestyle, reversing our health conditions, pre-diabetic, and hubby is severe non-alcoholic fatty liver. Before, dalawa lang po naisip namin pwede mangyari sa amin, mamatay kami. Nag-severe, naka-recover, pero nabaon sa utang. Oh, yeah. Pero anyway, that's good to know po na naka-recover na kayo. And many people will. Yun nga lang talaga. We need to fast right away and go low carb. Not just any low carb, keto talaga. Kasi take advantage of that anti-inflammatory effect ng ketone bodies. Yes, hello from Vancouver. Same time frame po tayo. Ang aga gumising ni Ms. Joveline Bohos. Hello po. Yes, from Hong Kong, Michelle Satira. Hello. Okay. Miss Lilia Guda, hello po. Magpapalaboratory sa dugo, bone scan, CT scan, at stage 3, 5 years ago. Okay lang po ba ang low carb? Yes. Pwedeng-pwede po. We have a video about cancer. Punta po kayo sa YouTube. So for all of you who don't know yet, yung complete library natin, discussing also itong thing about cancer, matatagpuan lahat sa YouTube channel. Same name lang. Level Up with Dr. Iris. It's the same name. Ganyan din yung name natin sa Facebook page. Level Up with Dr. Iris. Kompleto po ang library doon. Panoorin natin doon specifically about cancer. It's very fascinating. Napakaraming research na lumalabas about that. Yes, pwedeng-pwede po sa inyo. Thank you for your question. Hello, Mr. Nathan. Hello po. Thank you for watching sa YouTube. Okay, just simply Eve. Doc, 43 years old. Posible po bang mag-menopause na ako? Di na ako nag-mens mula nung November till this month, strict LCIF for 10 months. Yes, so August prolonged fasting. Ano po itong 48 hours, may 66, may 72. So, dyan po sa age group nyo, dalawa ang posibilidad. Number one, it can be because of the weight loss, yung fasting natin, yung paglo-low carb natin. That can also cause delays in your period. So, that's the first reason, maaring from the lifestyle lang. Ikalawa, can be real menopause na. Kasi some people can go into menopause at that age too. So, one of the two. How would you know kung menopause ka na 1 year? So, dapat 1 year wala ka ng period. Then, that's real menopause. But, it can still be adjustment sa lifestyle natin. Okay. Hello po sa mga taga-Samar. I hope everyone has recovered na po. Ano? Yes. Miss Lorraine, hello from Dubai. Hello. Salamat po sa panonood. Loida, Doc, okay lang po ba magpa-vaccine ng walang kinain? Halimbawa po, fasting ka, 1 p.m. kain mo, umaga po, magpa-vaccine. Okay lang po yun? Yes. When you are fasting, remember, yung inflammation markers mo are down. So, that's okay po. Yes, sino pa po? Hello from mga taga QC, from Taguig, hello po. Thank you, Miss Cindy, sa iyong ano, kind words. Hello. From North Cotabato, hello po sa mga North Cotabato. Yung best friend ko taga South Cotabato naman. Okay. Ito, next question. Val, mga ilang days po pwedeng mag-workout na ulit after magka-mild COVID? As long as your body can, you can actually work out. Ako, I did some walking. Bakit po? Kasi when we work out, when we exercise, napapataas lalo yung NK cells. Yung natural killer cells, which is panglaban sa virus, sa cancer, yung natural natin, immunity, tumataas siya kapag nag-exercise tayo. So, if you can tolerate it, it's okay. Yeah, it's okay to do po. From Hong Kong, hello po, Miss Francine. Facebook user from Denmark, kumusta po kayo? Yes, okay lang po kami. Okay, sino pa po may tanong? Jemima Mill. Pwede po i-discuss ulit why delikado mag-high carb from low carb and then balik ulit high, then low. Yung pinaka-full explanation po niya nasa YouTube, yung inflammatory effect. There are a few things. So number one, quick effect. Ano ba yung effect na ikaw ay low carb ka na? So remember, pag low carb ka na, ang body mo nagiging very sensitive siya sa insulin. Right? Dahil nagiging ulit siya, responsive. Ang problema kasi pag high carb, insulin resistant state tayo. Hindi na nakikinig yung ating mga cells kay insulin. So ngayon, pag naglo-low carb ka na at nagfa-fasting, yung body mo magiging sensitive ulit siya sa signaling ni insulin. So now, kung bigla kang kakain ng high carb, imagine gano'n siya ka-sensitive, right? Mag-overshoot yan si insulin. So a few things can happen. Pwedeng super bumagsak yung asukal mo, kasi pag super sensitive si insulin, magkakaroon ng spike, sudden burst, uutusan niya lahat ng glucose go inside the cell. Ano ba kasi ang trabaho ni insulin? It tells the cells to let glucose in para magamit as energy. So isipin niyo po ninyo, kapag super taas ng insulin spike, di lahat ng cells will allow the glucose to come in. So ano mangyayari doon? Sudden fall ng glucose sa bloodstream. So yung immediate effect will be, one, mga hypoglycemia symptoms, right? So nanginginig, hindi mo alam kung masusuka ka or hihimatayin, masakit ang ulo, nahihirapan huminga. So sudden decrease in glucose, hypoglycemia. So yun yung immediate effect. Merong long-term effect. Yun yung dinescribe ko dun sa video. It has something to do about yung reactive oxygen species, for example, na nafo-form, things that will later on clog your arteries and cause damage. So there were 5 factors that I discussed there. Puntahan po ulit natin. Nasa YouTube lang po siya lahat. Okay? Para talagang ma-digest natin yung long-term effect ng paulit-ulit na roller coaster. High carb, low carb, high carb, low carb. Anong ginagawa niyan sa katawan? Long-term damage ang ginagawa niya. It's very harmful sa mga ugat-ugat. So, and the thing with ugat-ugat, right? Hindi lang naman kasi yan sa heart, meron din yan sa brain. So, imagine all the damage that you're causing there by these sudden, kasi very inflammatory ang sugar eh. So, every time you flood your system, galing ka ng low carb, flood mo ulit yung system mo, parang inaano mo siya eh, parang ano ba yun? Parang binubuhos mo yung inflammatory cascade. Tapos paulit-ulit, ganun-ganun ka. So kawawa, pobreng ugat. What will happen? Heart attacks, stroke, possible pa kasi yung surge the surge of that sugar, right? So yun po yun, but the complete video nasa YouTube. Yes. Okay, so Miss Elizabeth Detiquez. Good evening, Doktora. Yes po. The more nagfa-fasting, napapansin ko hindi ako nasisipon. Dati po may allergic rhinitis ako, bahing ng bahing. Pag nakasumpong, now po it's gone. 4 months na po akong no rice, low carb, and intermittent fasting. Kaya lang yung BP ko ay 14/80, o 140/80. High blood po ba yun? Feeling ko kasi kaya ko naman at wala na akong nararamdaman na kakaiba. Yeah, so 58 years old. Di naman diabetic. Okay. Yeah, so you have to give it some time po. 4 months pa lang kayo na naglo-low carb. 140/80 is indeed high. Not too bad. pero it can be better. So bigyan lang po natin ng time. Many times, if we already have, I always see this sa mga comments, karamihan sa inyo, medyo matagal na yung mga high blood pressure ninyo, mga diabetes ninyo. Every person is different. Hindi porke nakikita natin sa community na yung high blood ng isang tao na reverse in 2 months, ganun din ang mangyayari sa atin. Many times we have to give it time. Kasi imagine nyo yung reversal nun, taon yan na meron dyan. So, it will need time. So, that's great po. At least nag-improve na, Miss Elizabeth, yung inyong rhinitis. Just wait for that pressure to stabilize. Okay po? Tuloy-tuloy lang tayo sa lifestyle na ito. It's great always to incorporate movement. Kung kayo ay hindi pa, kung panay low carb, intermittent fasting pa lang kayo, now is the time to start exercising. When you exercise, your pressure will go down. Yes. And si Miss Alcrish De Leon, hirap i-maintain ang keto sa quarantine hotel. Low carb lang, pinagtanggal kanin. Yeah, so try your best lang po. Eat the ulam. It's the ulam, right? If you eat the ulam, that's already, protein siya. So you will be able to maintain low carb dyan. Tanggalin lang talaga. Tama kayo. Tanggalin lang talaga yung carb. Okay. Okay, Miss Jovelyn, ask ko lang, normal lang ba outbreaks sa skin? Notice ko po kasi na dumami ang pimples ko. Some people will go through that phase. Other people will have clearing up. Give it some time lang po. It can be a transient phase. Yes, it can be. Kasi baka the acetone production. Acetone is one of the other ketone bodies na napoproduce, and it gets excreted through the skin. So it can worsen yung possibly, magkaroon ka ng flare-up. Tuloy lang po. Okay. Mr. Brian Espineda, Doc, ask ko lang po, halimbawa may gallstones, madadaan pa kaya sa low carb and fasting? So sir, great question. Yung existing na gallstones po, likely not, but the future formation, yes. Kasi gallstones come from the elevated din na cholesterol, calcium, cholesterol, mga stones, and your cholesterol will go down kapag tayo naglo-low carb. So yung naandyan na gallstone may not disappear. It can even transiently worsen. Some people will get parang cholecystitis attack. Yun yung pagbabara. Yung gallstone kasi, di ba? Imagine the gallbladder. Nandun yung gallstone. Pag kumakain ka more ng fat, na-stimulate siya, so magko-contract. Minsan yung existing gallstone na can get trapped doon sa neck ng gallbladder. So, can cause transient cholecystitis, yung mamaga. But moving forward, nakakatulong itong lifestyle na ito na mag-prevent ng future gallstones and syempre for overall health. So, it is okay to continue, pero I cannot guarantee matutunaw po yung mga dating nandyan na. Okay, just do it for the long-term benefits. In terms of yung matutunaw, not sure kung yan ang mangyayari po sa inyo. Okay. Stage 3 colorectal cancer, Miss Bebe Maldita. Ang ganda ng pangalan niya. Okay, mabilis tumubo ang tumor. He's now on low carb. Told him to do prolonged fasting, but he's taking pain reliever. How do we manage fasting if he's taking meds? Mainly po, kung OMAD naman, you can always take the meds doon sa time na hindi ka fasting. Occasional na, there are only, really very few meds na sabihin mong you really need food. Kung kailangan ng food, always choose fat alternative. So avocado is pretty good, right? Let's say, kasi even if you eat a small piece of avocado to take with your meal na fasting ka, it's still okay. Bakit po? Kasi avocado, it can be like a fast mimicking diet. Ano ibig sabihin nun? If you keep the caloric intake below mga 500 calories, tapos fat naman yung kakainin mo, like in this case, avocado, right? It's very low net carb, tapos highly fatty siya, then it is okay to go with your medication, but it will still mimic fasting. So, fast mimicking diet. So, ang isama na lang po niya doon sa food, kung hindi talaga kaya, will be avocado. Okay. Magandang gabi, Miss Marvy. Hello po. Yes. Maray na banggi sa gabos ko po ng mga kababayan dyan sa Bicol, Miss Miriam Antoinette. Salamat pong maray sa pirming pag-iling. Kumusta po kamo gabos dyan? Kaipuhan po, ipasabitan na sa mga kapitbahay ta diyan ano, na magpuuna sinda mag-fasting tsaka low carb. Sana po iguanang may nagtitinda diyan ng mga low carb ano, sa Bicol? Yes. So, kamusta po? Okey. Okey, Miss Emma, Doc, good evening. Last December 16, nagka-mens ako, marami, 51 na ako ngayon. Napaaga January 7, madaming matagal mawala, aabot na ng 1 week. So for anyone now, if you haven't had a period for 1 year, ano bang definition ng menopause? No period for 1 year. Let's say 1 year na po kayo, Miss Emma, wala kayong period, ta's bigla kayong nagka-period, that's always worth investigating. Okay? Any post-menopausal bleeding should be investigated. Pasuri po sa doktor, kailangan ng ultrasound, kailangan ng blood work niyan. Okay? Miss Eva Kaamik, thank you for watching from YouTube. Hello po from Calamba. Okay lang po ba mag-low carb ang may kidney stone? Okay lang naman din po. Sometimes there is worsening. Just make sure that you are hydrating well, ano? Kasi sa paglo-low carb lifestyle natin, we tend to pee a lot. And when we pee out, we can become relatively dehydrated. Ihi lang po I mean, inom lang madalas kasi mag-worsen ang stone formation kung kulang tayo sa fluid. Sa pagla-lifestyle natin, talagang natural na ihi tayo ng ihi. So make sure that you don't get dehydrated. Okay? Mr. Martin, yes, Mr. Martin, parehas kayong pangalan ng aking anak. From Laguna, Philippines, salamat po sir, watching sa YouTube. Okay, from Saudi, Miss De Leon Gamad Gladys, hello po sa mga kababayan natin na nasa Saudi. Okay, Miss Cecile, there is a very long video I made about this. Ano mangyayari kung mag-cheat? Pakihanap po. Level Up with Dr. Iris YouTube. Napakakumpleto ng explanation ko doon. Long story short, katulad ng sinabi ko kanina, dalawang effect, immediate effect and long-term effect. So, hindi po maganda mag-cheat. No need to cheat, napakarami nating recipes. Lahat ng mga gusto ninyong kainin na high carb, karamihan dyan, I would say maybe 95%, meron na pong low carb counterpart yan. Kaya nga po, join sa groups natin, join sa mga communities natin, para makita yung mga iba't ibang recipes na, so this is my own community, low carb fasting holistic wellness community. Mga tao dyan nagsishare ng mga iba't ibang pagkain, ayan. Iba't ibang pagkain na masasarap, iba't ibang pagkain ng mga low carb, ayan, ng mga transformation. So, join lang po kayo dyan sa mga communities natin. Napakarami pong mga example ng mga pagkain na masasarap na low carb. Yung mga gusto ninyong high carb, in a few days, ilalabas ko na yung aking low carb pizza. Gustong-gusto ko yung pizza eh. But I don't like the base, yung flour. So, meron naman yung counterpart. Lahat po ng mga gusto natin may counterpart. Mabibilang lang yung halos walang counterpart na pagkain na low carb. Okay? So, try lang po natin. Mr. Nathan, 1 month na po ako ngayon low carb. Nag-decide ako mag-low carb dahil sa dami ng nararamdaman ko, may lumbar and thoracic problem. May naipit daw na ugat, bandang puweta, nag-numb buong katawan ko. Yes, sir, it's a great alternative. Marami tayong mga community members who benefited yung kanilang mga muscular, low back pain, mga ganyan sa lifestyle na ito. Isa rin kasi dyan sa nakaka-contribute ng mga low back pain is yung body dynamics, right? When you are overweight, ang mangyayari kasi is nagbabago, nag-shift yung center of gravity mo. Lalo na sa lalaki. Saan ba ang lalaki nagiging, kung lalaki po kayo, sir? Anyway, saan ba ang lalaki nagiging malaki? Sa tiyan, right? And so it shifts your center of gravity para kang buntis. Anong mangyayari sa lumbar spine mo pag mag-shift yung center of gravity mo? Puts too much pressure. It alters yung dynamics ng likod. So, it's good to lose weight. Samahan natin ng movement. Mag-strengthening tayo, right? And it will improve. Siyempre, sa paglo-low carb, mag-improve siya. Yes. Miss Karina Lumagi Besa. Doc, I started LCF mid-November 2021. Last week, I have ultrasound, have cholesterolosis of gallbladder. Nasobrahan po ba sa pagkain ng fats? Hindi po fat. So, what causes, gallbladder stone? high cholesterol. What causes high cholesterol? High carb diet. It's not the fats, guys. 80-20 rule. 75-25 pa nga eh. Sabi ni Dr. Berg. So, 25%, 20 to 25% lang ng kakainin nyo na cholesterol will be parang taking part in that cholesterol na ginagawa ng katawan ninyo. The bigger part of it comes from inside transformation. Galing sa high carb. Hindi siya sa fats galing. It's from high carb. Yung high carb na kinain natin, yung asukal na yon, ang gagamitin ng katawan to make yun yung raw material to make the cholesterol. You're eating too much carbs po, Miss Karina. So you have to decrease your carb. It's not the fats po. Singapore, hello sa mga kababayan natin dyan. Kumusta po ang lahat? Davao City, hello po. Yes, and Cotabato again. Marami tayong viewers from Cotabato. Yes. Yes, sir. I highly encourage you to do that. Yes. Tuloy lang po natin. Think about the longer term benefits. Yun po yung isipin natin. Okay. Okay, Miss Gina. Totoo po ba mas effective ang dry fast like di ka rin iinom sa loob ng 18 hours? There have been some proponents ng dry fast na mas healing daw siya. Personally, I also do, kapag nag-extended fasting ako, so when I go to and do my 72-hour fasts, yung first day niyan, dry yan. I don't actually drink. Kasi your body can make water po eh. So, ano ba yung logic dyan? Bakit ba kapag kahit hindi tayo umiinom, okay pa rin siya? Kasi your body, through the metabolic processes na nangyayari, can always make water. Gumagawa siya ng water as a byproduct ng mga metabolism processes natin. So, you're okay. Ang word of caution lang syempre lagi dito are, people who have maintenance medications, tapos meron ng mga sakit. We don't, want to just say na mag-dry fast ka. Kasi, that can make them prone, lalo na uminom ka ng, ng gamot mo. For example, diuretic, right? Yung diuretic mo, so that's something that will make you pee out excess fluids. Tapos, ininom mo yun ng day before. Tapos magda-dry fast ka. Then, you continue to pee out, right? You're peeing out kasi andun pa rin yung gamot. Then that can put you in a state of dehydration. So, para ito sa mga healthy. Kung ikaw ay healthy, wala ka namang iniinom na gamot, walang maintenance. You can certainly do dry fast. Yung mga proponents ng dry fast are saying na mas cleansing, mas maganda siyang detox. Ako, I also do it during the first day nga ng aking extended fasts. Second day, magiinom na ako ng fluids. I don't normally go like 24 hours. I would just maybe do dry fast 18 na wala talagang kahit ano. And then after 18, I will start my electrolytes. Ayoko kasing ma-feel yung symptoms, syempre. Right? So, yeah, you can do it as long as you have stable medical condition and you are not taking medications that will make you dehydrated. It is okay to do. Very cleansing daw ang dry fast. Yeah. Mr. Edwin Palasige, madami po ako iniinom na tubig. Okay lang ba laging umiihi? Tama po na madaming intake ng tubig. Yes, sir. Ngayon, in the context of, so sir, kung tayo po ay nasa induction phase, ibig sabihin nagsistart pa lang tayo ng low-carb lifestyle at nag-aantay pa tayo na maging fat-adapted yung katawan natin. Natural yan na mafe-feel natin na gusto natin laging umihi. Bakit po? Kasi yung ketone bodies, so yun yung fat bodies, yun yung ginagamit na ng katawan natin pag tayo ay fat-burning mode na. Ang main mode of excretion yan is urine, so urination. Kaya napapadalas ang pag-ihi. So ngayon, importante po na kung nakakaranas tayo ng mga symptoms like panghihina, palpitations, cramps, numbness, masakit ang ulo, yung mga keto flu type symptoms, masakit ang kalamnan, we need to not just drink water, kailangan po may electrolytes. Okay? So kung wala naman, sir, kayo ay fat adapted na, hindi na kayo nakakaranas ng mga side effects na yan, it's okay to just drink water. Again, electrolyte replacement, nangangailangan tayo niyan kung meron tayong mga sintomas. 'Pag wala ng sintomas, it's okay, just to have water po. Okay, Miss Marife, ask ko lang po, normal lang ba magkaroon ng pasa? 4 months na po. Yes, some people will go through a phase na nagkakapasa. Ngayon, if persistent, kailangan po natin pasuri ha, kasi there are other medical conditions that can cause yung pagpapasa. Usually like an issue with yung inyong mga blood components, yung, is there an issue with your platelets, mga ganun po, ano? Kung persistent, please have it checked out. Okay. Miss Luz Viminda, Capiznon, low carb na po ako 3 months, ayoko pong pumayat kasi hindi naman ako mataba. Ano pong gagawin ko? Ma'am, ang gagawin po natin, punta tayo doon sa Level Up with Dr. Iris YouTube. Meron akong 2 videos about that. Number 1, paano wag masyado pumayat sa low carb. Number 2, build muscles. Kailangan po ng maayos na explanation about this. Ginawa ko po yung video na yon kasi alam ko magtatanong kayo. So pakihanap na lang po yung video na yun. Nandun po ang kumpletong kasagutan. But the main thing is, you do have to meet your protein requirements. You do have to build muscles. Yun po yung gist ng videos. And panoorin po natin yung 2 videos na yun. Okay, Mr. Martin, kailan iinom ng electrolyte? 1 month na. Kapag may symptoms lang po, sir. Pag walang symptoms, it's fine. Okay? Pag may symptoms lang. Ano ba yung symptoms? Katulad na nabanggit ko po, keto flu. Masakit na mga kalamnan, nangihina, nagkaka-cramps, nahihilo, sumasakit ang ulo, nahihirapan huminga, foggy brain. Yun po yung mga sintomas ng keto flu. Kung meron po nun, pwede tayong uminom ng electrolyte solution. Saan matatagpuan? Doon po sa video natin about low carb side effects. Nandoon naka-outline yung ilang electrolytes, paano gagawin yung homemade na electrolyte solution. Sir, wala po ako. Meron po akong free na Zoom meets sa loob ng aking community. Again, yung mga kailangan magtanong sa akin, hindi po ako nagkukonsulta online. Pero pwede ninyo ako makausap. Join kayo sa aking community. Diyan naka-publish yung susunod natin na Zoom meet. Ang ine-encourage ko dito na mag-join sa Zoom, yung mga walang pambayad sa doktor. Pero welcome din naman umattend yung mga kahit afford ninyo. Pero let the people without pambayad speak first. Okay? Public service po yun. So, okay, from Albay. Mga kababayan ko po, kumusta gabos dyan? Okay. Miss Len, Baking Gemsville. Doc, what can you suggest if a person cannot sustain low carb? Sino pa ang gustong sumagot kay Miss Len? It's never a good idea to stay high carb. Low carb has many different, never ever ever po a good idea to stay high carb. You will only get diseases kapag kayo nag-high carb. Pag hindi masustain, there are a few tricks. Paano ba masustain? I made a video about this po. Pero to sustain it, look at this. Tingnan niyo po yan. 3 uri po, right? So, most of the people will have difficulty sustaining keto. Kasi ang keto, you can only eat so much, meat and eggs. Yun yung sinasabi ng karamihan. Moderate will offer more variety. Yung 50 po na yan, look at this, 20 to 50 grams. That's really a lot of, possibly iba't ibang uri ng nutrient-dense na low-carb veggies, for example. So it's gonna give you a lot of options po. Honestly, Miss Len, you have to join the communities. Doon makikita ninyo, endless ang possibility ng mga pagkain. Endless. Napakaraming sharings doon. Mga recipes, mga iba't ibang pagkain. Ako nga, that's what I do. Pag hindi ko na alam kung anong hinulutuin ko, titingnan ko lang ano ba yung mga ideas dito ng mga members. And that's what I do, right? It only, it only gets boring if you only know so much, right? Kaya nga, meron tayong support groups. Kailangan natin kumuha ng idea from our fellow members, okay? It's never a good idea to go back to carbs, high carbs. You will just get diseases po. Diabetes, high blood pressure, cancer, neurodegenerative disorders, memory problems, immune problems, joint pains, high uric acid, gout, GERD, lahat po, fatty liver, PCOS, lahat, you name it, you will get it with high carb. Maraming options, okay? Join our community po, Miss Len. Pag hindi pa naka-join, join our community. Napakarami doon na ideas. How you can sustain, ano yung mga masasarap na pwedeng kainin. Okay. Miss Sampaguita, diabetic po ako, okay lang ba Quaker Oats kinakain? High carb po yan, ma'am. So sa mga hindi nakakaalam, puntahan niyo po ito. So dito, sa ating webpage, levelupwithdriris.com, mada-download po ito. Ang pinaka kasi gabay natin when we are starting with this lifestyle, so yan ay food guide. Sa food guide, sa green, yan o, yung go, parang traffic light, no? Go, pause, stop. Sa go tsaka sa pause, yung mga pagkain na maaari nating kainin. And kung magsistick tayo dyan, maiwasan natin yung high carb food. Oats are high carb, kailangan iwasan po. Okay? So, doon po natin mahanap levelupwithdriris.com. Libre lang po yung resource na yan. Okay. Miss Roxy Torres, good evening from Davao. Hello po. Tanong ko lang, diagnose ako ng multiple PCOS. 4 months na po akong low carb. Hindi pa po ulit ako nakakapagpa-check up. Tanong ko lang po, nawawala na po ba yung PCOS ko? The only way to know, ma'am, is to have your ultrasounds. Kailangan ng objective measure dyan. Hindi po natin pwedeng hulaan. Okay? So guys, if you have a medical condition that you are reversing, and that's the reason why you started your LCIF lifestyle, you always have to have objective measure. Hindi po yan dapat hinuhulaan. So until you get your ultrasound again, doon po ninyo malalaman kung wala na siya, but certainly reversible with our lifestyle. Yes. Okay, Mr. Ariel Magallanes, Doc, parehas po kami naglo-low carb ng asawa ko pero marami pong tumutubo sa asawa ko na mga katikati. Yes. So, yung katikati po, keto rash. Bakit nagki-keto rash? Bakit? Acetone. Yung acetone na isa sa mga ketone bodies, again, pag tayo ay naglo-low carb, nagta-transition tayo from sugar to fat burning. Pag tayo ay nagbo-burn ng fat, ang ginagamit na enerhiya ng katawan natin, hindi na siya asukal. So it's no longer glucose, it's fat bodies. Ano-ano mga fat bodies? 3, beta-hydroxybutyrate, acetoacetate, tsaka acetone. Yung acetone, the way that it gets excreted is balat, nag-evaporate. Pag nag-evaporate, makati, pantal-pantal. Keto rash ang tawag dyan. It is a transient effect ng lifestyle na ito. Ano ang solusyon? Hydrate well. Pwedeng taasan ang carb intake ng konti, pero doon pa rin pipili sa green section ng ating food guide. Tataasan lang. So say for example, kayo ay talagang strictly keto, kaya kayo nagkaroon ng matinding rash. Ang gagawin ninyo, let's say you're staying below 20, dagdagan lang natin. Maybe gawin natin 25, maybe gawin natin 30 grams. And usually, magdi-disappear din yan. Once the body gets fat adapted, you no longer will feel that. Okay? So, keto rash po yan. Safe po ba, Miss Maymay Lagasca, safe ba mag-extended fast every week? Ganda kasi ng feeling ko kapag naka-long fast. Okay lang po yan if your body can tolerate it. Be flexible. Have different time frames. It is okay. Are you talking about 72 hours ba, Miss Maymay? That's still good to do. If you're gonna do 72 hours every week, that's still fine. Kung kayo naman ay healthy, walang iniinom na gamot. Fasting is certainly very healing. It's the most natural detox you can do for your body. Okay? So, pinaka main benefit ng fasting obviously is autophagy. Sa mga bagong-bago, ano yung autophagy? Autophagy, auto, self, phagy, eating. Self-eating. Kinakain ng katawan natin yung mga sirang components niya, and in that way, tayo ay nakakapag-heal. Kaya siya very good for diseases like dementia, for example. Dami ng data with Alzheimer's dementia, Parkinson's, kasi yung mga abnormal proteins na nakadeposit sa brain, nawawala pag tayo nagfa-fasting kasi kinakain ng katawan ulit, nire-recycle. So that's the power and beauty of autophagy. Detox. Okay. Miss Lynn Francas, good evening, Preggy po ako 14 weeks, need po ba mag-low carb? So, usually, it's good to stay low carb in any ways, right? Kasi kahit sa mga babae who, for example, develop gestational diabetes, mga babaeng nagkaroon ng diabetes habang buntis, it actually is the treatment. Yun talaga yung treatment niya, nutritional, so low carb. Ngayon, just make sure po sa pregnancy, may kakaibang requirement yan. Make sure that you are meeting your protein requirements. Remember, dalawa na kayo. Very, very important. Meet your protein requirements. Mas mataas ang requirement natin sa pregnancy. You can go as high as 2 grams per kilogram body weight of protein per day. So for example, 50 kilos kayo, Miss Lynn, you can go up to 100, no? 50 kilos times 2 gram per kilogram body weight, 100 grams protein per day. Make sure mamimit natin yan. Okay lang mag-low carb, pero kailangan ma-meet ang protein and fat requirement. Okay, yung allergic sa eggs and chicken, pwede pong ibang proteins. So you can go plant-based, you can go pork, you can go beef, pwede rin dyan yung, for example, not so much, pero pwede rin dyan yung, syempre yung nuts, plant-based po, plant-based protein sources. Not so much yung, some people will go for soy-based products. Not so much kasi gawa ng inflammatory reaction. So, tofu, mga ganyan, paminsan-minsan. Okay. Okay, Miss Gina Valdevia. Teka muna ang kati ng buhok ko. Okay, hi Doc. Nag-low carb po ako 3 months, pero minsan, nadadapa ako. Like 16 hours ako naka-fasting. And hindi na ako kumakain ng rice. Hindi na ako high blood, Doc. Pero yung problema ko, nag-smoke ako. Yeah, Miss Gina, kailangan po natin yan i-stop, ma'am. It has many, many detrimental effects. Tsaka yan, pro-inflammatory, right? And it's very hard on your lungs. Try po natin. Kung hindi kaya, there are a few alternatives. Pwede tayong humingi ng prescription to help us stop it. Pwede rin yung mga nicotine, patches, mga ganyan. Pwede rin hypnotherapy. Gawin ninyo ang dapat nyong gawin para ma-stop yan. Because kahit kayo maglo-low carb, kung magsusmoke pa rin kayo, this one is really not beneficial for your health in any way. Kailangan po natin i-stop yan. Okay, Miss Fe Mercado, I really don't know how to start LCIF. I know we really have to because my husband has pre-diabetes. Although taking medicine and little dieting did lower his blood sugar, latest blood chem results to a little higher presence of creatinine, high cholesterol. Yeah, so great idea po ito, Miss Fe. Paano ba mag-start? Paano mag-start? Join po sa communities natin. Doon sa community natin, nandun yung guide. Pero ito, i-flash ko na rin dito. Here's the guide. Paano mag-start? Unang-una, kailangan maglo-low carb muna tayo. Paano ginagawa yung paglo-low carb? Ida-download yung food guide, right? So steps to follow. Number 1, start by going low carb, 1 to 2 weeks, sometimes 2 to 4 weeks. Depende sa tao, every person's different. Number 2, once kayo ay fat adapted na, so be faithful to the food guide. Diyan sa time na yan, diyan sa number 1, kung nasa step 1 ka pa lang, be faithful to the food guide. Sundan lang po natin. Again, it's always a great idea na tayo po ay nagjo-join ng communities para meron tayong mga inspiration. Ano ba yung kakainin natin? Right? Not only that, we can get support there as well. So yun. Not only that, inspiration din. Makikita niyo yung mga transformation nila. Talaga nakaka-inspire. Imagine, tingnan yung mga transformation. Hindi lang din naman physical, right? Kasi it's a transformation nung pag-reverse ng medical condition, like yung sa husband po ninyo, the diabetic, tapos yung blood pressure, right? So ito, katulad yan, tingnan ninyo, yung transformation na yan, right? How powerful is that? Diabetes, pareha sila, high blood pressure, ngayon wala na, right? So, join the communities, download the food guide, be very faithful to the food guide, okay? Be faithful to that, parang relasyon lang yan, right? And then, get the support from the communities, get the inspiration ng mga kakainin. Step 2, kapag kayo ay fat adapted na, then you start your intermittent fasting. Huwag agad magfa-fasting nang hindi naglo-low carb, hindi ninyo masusustain. Mahihirapan kayo. Okay? After that, have good quality sleep. So ito, importante po yung 3, 4, 5. Yan yung pinopromote ko sa community ko, nakakaiba. You have to have good quality sleep. It affects diabetes. Kahit gano'n nyo kagaling mag-low carb fasting, pag hindi kayo natutulog ng maayos, pag punong-puno ng stress ang buhay nyo, toxic stress, at hindi kayo gumagalaw-galaw, hindi nag-exercise, your journey will be much, much more prolonged and hindi siya optimized. So, importante yung 5 components. Yan lang po yung steps. Nandyan yan sa loob ng communities. Pwede nyo rin i-screenshot. Ayan. Take a moment na i-screenshot yan. Those are the steps po. Okay. Thank you for your question. Okay. Okay, Mr. Jesse Pamplona, what do you think about the 21-day Daniel prayer and fasting? Very healing daw po yan, sir. I haven't tried 21 days kasi 3 days pa lang, sobrang, I don't have any fat to lose. So, I get very, very thin. Hindi ko pa po yan, sir, try. Siguro kung marami akong reserve, I will try that. Kaya lang, pag day 4 na ng fasting, wala, nakalansay na lang po ako. So, but for you guys who, have the opportunity to try this, longer fast, sabi nila, can be very healing. Iba-iba naman yung data. Sabi ng iba, beyond the 7-day, wala na daw benefits yan other than losing weight. So for people who do fasts beyond the 7 days, kasi, the peak of autophagy, so yun yung self-cleaning process na sinasabi ko sa inyo, the peak of that is 72 hours eh. So 3 days. Kaya ako, I do my day fast ng 3 days, a little bit over, minsan mga 74, ganyan. And then after that, wala na siyang peak, yun na yun. So anything more prolonged than 3 days, weight loss na siya. So yung mga naririnig na nagfa-fast ng beyond 7 days, nagbabawa sila ng timbang. So ito, 21 days, if you don't have contraindications, wala kayong iniinom na gamot, wala kayong, sakit na unstable, it may be worth a try as long as meron kayong fat reserves, right? Hindi pwedeng gawin ito kung kayo ideal weight na. This is too much. You will waste. Like me, I don't go beyond 4 days kasi it will be too much. I'm not doing it for weight loss. I'm doing it for autophagy. Kung weight loss ang pinupunterian nyo, sure. 21 days, you can go for it. Do your fluids. Electrolyte replacement is very important sa mga 21-day fasts. Yung multivitamins is important. Mga supplements, importante yan. Pag ganyang kahahabang fast. Yeah. Amino acids, proteins, right? Kasi magbe-break down kapag ano. Pero if you have a lot of reserve pa rin na fat, should be fine. Okay, matutunaw ba ang kidney stone sa fasting? Not a guarantee. Usually, pag mga existing na po, so gallstone, kidney stone, usually mga existing na, wag nating asahang matunaw. Ang nito is more prevention, mape-prevent yung upcoming. Yeah. Okay. Hello po, Doc. Di na po ako nagkakanin ulam. Ulam na lang po. Is it okay po ba gulay and meat? Pero meron din palang gulay na parang di pwede. Ampalaya is good po. Yes. So, paano po malalaman, Miss Corazon? Again, food guide po. Para malaman natin, andito, napakahaba ng ating listahan, mga gulay na pwede. Lahat matatagpuan sa food guide. Yan. So, tingnan niyo yung green section dyan. Ayan o. Yung kanyang, yung carbs. Yan, vegetables. Napakahaba ng listahan. And ampalaya, that's okay po. Okay na okay po si ampalaya. Okay. Hello po sa mga taga-Kuwait. Okay. Okay, Mr. Efren Gabutan. Hello, Doktora. Napapansin ko po kapag nag-electrolytes po ako kay low-carb method, nag-low blood po BP ko. Bakit po kaya? Okay. So, sir, baka coincidental ito. Normally, if you keep well hydrated, tapos yung electrolytes nyo naman ay, ma-replenish, it shouldn't really be a problem. What do you mean by low BP po? Kasi baka normal pa rin po yan. Blood pressure that goes down but without any symptoms, still okay po pa rin po yan. Kunyari, kung nakita nyo 100/70, para sa inyo low na yon, that's still fine as long as wala po kayong sintomas. And keep well hydrated and keep those electrolytes replaced. Kasi yun naman ang issue dyan eh. If you pee out a lot, then yung pagbagsak ng pressure na yan, especially with the symptoms, will be the problem. Pero baka coincidental lang po to, sir. Monitor po. Sulat po ninyo. Tignan po ninyo kung ano yung mga amounts. Okay lang po ba avocado smoothie, no sugar, almond milk? Yes po. Maray nabanggi po sa gabos na nag-iiling, Miss Vanessa Carino. Salamat tunon pong maray pirmi sa pag-iling nindo. Maray nabanggi, Miss Weng Bonifacio, hello po. Okay, yes. Purong Bicolana po. Diyan ako nagdakula hanggang 12. Pero daay man na lilingawan, pirmi man nagtataram po. Yes. Okay. 64 years old pero parang nadagdagan lalo ang pagka-old looking nung pamayat. 140, 180 na ako. Yes. So ito po, it can happen. It can happen. Ang isa sa mga ano po niyan will be, sometimes make sure that you are well hydrated. Kasi yung dehydration din nakaka-cause niyan. It's normal to see that po, ano? Pero over time, it will, kumbaga parang nag-i-improve naman siya over time. You can also take collagen supplements, basta wala pong carbs ha. Collagen is very helpful. Meron siyang ano talaga data na, pero yun nga, make sure to read the label, dapat walang carbs. Sa una lang po yan, dahil nga, na-notice mo yung difference, but it settles down eventually po. Yeah. Okay. Okay, Miss Criselda Urbano, ask ko lang po what's the right time to take supplements, if during feasting po ba or fasting? Sa feasting po, yeah. Umad po ako, Doc, I'm taking vitamin C, D, calcium, vitamin B complex, yes. Pwede po yan, ma'am, sa inyong sa inyong non-fasting time. So, eating time. Okay. Okay, Miss Jenny. Good evening, Doc. I started my low-carb September last year, had a slight fever last January too. I took paracetamol, nawala po, gana kumain, kaya napakain ng bawal. Oh my. Bakit po? We have low-carb version. Ang sarap-sarap ng low-carb na cheesecake. Super. Yeah. Napakain daw siya ng low-carb, ng blueberry and chocolates. After that, dami ko naging rashes sa legs and arms. Nagka-gout din po ako. Now, nahirapan na ako lalo kumain kasi di ko na alam kakainin. Namaga lalo ang gout ko. I took diclofenac. I tried buying potassium over the counter. Di pala pwede. Okay. Miss Jenny, get back on track. So, sa lahat po ng mga nadadapa, consider it as a learning experience. Don't be too hard on yourself. It is a learning experience, right? You can see the power of good nutrition. Kapag tayo ay kumakain ng good nutrition, ang katawan natin, the body loves us for it. Kapag hindi, pinaparusahan tayo ng katawan. So what do we do? Kapag nadapa, learn the lesson. So ano yung lesson? Hindi mo na uulitin. Ikalawa, know that there are low-carb alternatives to that, right? Merong keto chocolate, merong mga fat bombs, merong mga cheesecake na pagkasarap-sarap. Na-try nyo na po ba, Miss Jenny, yung aking burnt Basque cheesecake? Sobrang sarap po nun. It's low-carb. Nasa YouTube din. Ikalawang gagawin. So una, learn the lesson. Ikalawa, go fasting right away. Fast. Try ninyo mag-cleanse kung kaya. I-fast ninyo yan. Bakit? Para ma-wash out yung insulin. Gumanon eh. Nag-spike super taas. Let it wash out. 18 hours before siya mag-wash out. Fasting. And then, bisitahin ulit natin si Food Guide. Puntahan natin si Food Guide. Mag-renew tayo ng pack natin kay Food Guide. Food Guide, I'm gonna be faithful to you again. Balikan natin yung mga communities natin. Tingnan natin mga food inspiration doon. Right? Para maplano na natin. It's always a good idea to have yung parang menu, right? Isulat niyo lahat ng mga nagka-interest kayong mga pagkain doon. Gawa na kayo ng menu for the month. Even yung mga treats. Kasi ina-anticipate yan eh. Yung mga ganyan, yung mga tao who, go through stress, right? Many of us are emotional eaters. So, katulad niya, na-stress kayo dahil nagkalagnat kamo kayo. So, yun, nawala ng gana kumain. Yung iba, emotional eater. You have to anticipate that, guys. Anticipate it. In moments na, for example, nagki-crave kayo ganyan, always have kasi na stock sa bahay ninyo yung mga ingredients for making your treats. Kasi minsan ganyan, eh, nagdaraan ka ng stress, feel mo parang gusto mo i-treat yung sarili mo, eh, di 'pag ready-made yung ingredients. Like for example me, hindi ako nawawalan ng cream cheese, kasi I like making yung mga cheesecakes, mga iba't ibang klaseng cakes. Hindi ako nawawalan ng almond flour. So dito sa ating food guide po, meron diyang baking section. Dapat yung mga laman diyan lagi kayong meron. Almond flour, coconut flour, right? Even yung mga things like santan gum, mga iba't ibang nuts, things that you will use for your baking. Cream cheese, right? Erythritol, stevia, monk fruit, dapat lagi kayo meron yan para yung mga moments. Eh, madali lang naman gawin yung mga low carb desserts. Ang bilis nga eh. Hindi nga siya katulad ng ano ng high carb na ang daming proseso. Ito, halo-halo lang eh. You have to anticipate it, okay? And then kapag in-anticipate mo, then you can treat yourself better, right? So kung nadapa na, ganun lang. Wash out natin si insulin by fasting. Again, learn the lesson, wash out by fasting, go low carb. Balik loob sa community, kuha ng inspiration dun from the postings ng food. Okay? Anticipate natin. Gawa tayo ng menu. Okay. Okay, Miss Krisa May Cabale. Good evening, Doc. Thank you sa mga advice. Doing low carb 3 months, 63 to 54. Congrats. But after the holidays, I gained 1 to 2. Yes. Ganun po ulit. Same advice. Yeah. Oh, thank you. Ang cute naman ang sinabi ni Miss Leonor. Happily watching from Taytay, Rizal. Thank you po. Hello sa mga taga Taytay. Hello. Okay. Taga Iriga, kamusta po gabos dyan? Ng mga kababayan ko. Di po ako tatao magtaram ng Iriga. Dipisila. Dipisilon pagtaramon ang sa indong dialect. Ano lang po kita. Legazpi, Bicol. Shout out mga taga Legazpi. Gubaya digdi po na mga taga Legazpi. Saan po kamo gabos? Ayan. Okay, from Davao Sur. Hello po sa mga taga Davao. Tacloban, hello po. Ay, saan na yun? Tacloban City, Miss Rochelle. Hello. Okay, Mr. Ferds Francisco. Advisable po ba, Doc, ang fasting? I have ulcerative colitis. Sir, yes. Ulcerative colitis, the issue is inflammatory, ano siya, ano? It's an autoimmune condition, tapos meron pa siyang inflammation component. Fasting is always going to be very healing. Yes, so okay lang po yun, sir. Make sure din na, ano, of course, you are taking your medications for that, pero fasting will be very beneficial din po. Miss Emma Byron, okay lang po ba intermittent fasting 16-8? Okay lang kasama peanut butter, hindi po tumataas ang uric acid kapag nasobran kumain ng mani. Peanuts, so a few things about peanuts, right? Number one, alamin ang inyong net carb allowance. Kung pasok pa rin siya sa ating net carb allowance, you know, for example, you decided na ikaw ay moderate low carb, so below 50 grams, then pasok pa rin naman siya, that's okay. Kung ikaw ay naglo-lose, gusto mo mag-lose ng weight, kung ikaw ay may diabetes, fatty liver, tapos ang problema talaga is still a bit of obesity, I would watch the peanuts kasi high calorie ang peanuts eh. Although we don't normally count calories sa lifestyle natin na ito, we normally just look for the insulin stimulation. But the thing is, pag medyo malayo pa po yung journey na tatahakin ninyo, peanuts, medyo ano siya, high calorie load siya. So, may need to be careful about this. Kung kayo ay ideal weight na, that's okay. Yeah. Basta pasok sa inyong low carb allowance for the day. Okay, Miss Chapoy Cambro. Good evening from UAE. Hello, mga taga UAE natin dyan. Yung pamangkin ko po, nangingitim ang paa. Normal ang liver function pero nagkaroon ng perihepatic ascites. Pwede po ba mag-low carb? So ano po yung cause? Kailangan natin malaman. Kasi pag meron na tayong mga ganito, na mga disease states, we need to know why. Bakit siya nagkaroon ng ascites? It's not enough na ascites lang. There's always a reason for that. And once malaman na natin kung ano yon, as long as stable yung medical condition, you have to still work closely with your doctor po. Ano? Okay lang ang paglo-low carb in general terms, Pero when you have an active disease condition, minsan kasi may mga restriction yung ganyan, ano, like sa protein, for example. So if the disease is still active, you haven't even figured out kung ano siya, wala pang firm diagnosis, I wouldn't do low carb just yet. Kailangan malaman ano yung diagnosis kasi yun nga, it changes yung ball game in terms of protein requirement. Sa lifestyle natin, alam niyo, we eat protein, right? Not too high, but it is, substantial. So protein, tapos meron tayong fat, right? The fat shouldn't be too much of a problem, but it's the protein. So anong klaseng ano yan? Anong klaseng disease meron siya? Anong klaseng liver disease yan? What's the cause of the ascites? Okay? Kailangan po natin ma-figure out yan. Hello, Miss Sweet Jam from Bahrain. Hello po, mga babayan natin dyan. Sir Edwin from Silang, Cavite. Hello, sir. Yes, Miss Roma Cablinda from Davao Oriental. Kumusta po? Okay, you're welcome po. Maraming salamat. Facebook user from Manila, Mr. Haron Muhammad. Hello po. Okay, Miss Al De Leon. Totoo po bang pag wala ng gallbladder, cannot digest yung mga leafy veggies? Kasi mother ko wala na siyang gallbladder dahil sa stones. Ang ano po natin dyan, so great question. The gallbladder, ano yung kanyang function? Lalagyan na ng bile. Ano yung function ni bile? Pang-neutralize ng fat. Yung green leafy vegetables, they're not fat. Carbs po yan. Low net carbs. It shouldn't be a problem po. Hello, Miss Rhea, ang ating speaker dati. Thank you for watching. Hello. Okay, Miss Sel Mondala. Is it normal to have kidney stones after 5 weeks ng low carb? Measures 0.2, upper right. So, maliliit lang naman. Also, my total cholesterol goes 8.62, trigly 0.97, LDL 6.26, uric 344. Okay. Here in the Philippines, 2 months holiday, currently on quarantine. Okay. So, ito po, all right. So, the kidney stone, some people will develop kidney stones sa LCIF. I cannot tell for sure kung gawa ng paglo-low carb ninyo yung pag-kidney stone ninyo kasi it can also be coincidental. Just make sure that you are hydrating well po. Ano? Kasi as we've talked about, you do tend to lose a lot of fluids sa paglo-low carb. So sometimes, certain people can be predisposed na mag-form ng kidney stones. When it comes to your cholesterol, meron po akong video about this. Cholesterol. Posibleng tumaas transiently si cholesterol. Your trigly looks good. Yung LDL shouldn't be a cause of concern until ma-check natin aling uri ng LDL. Okay? Because there are subtypes ng LDL. Hindi lahat ng LDL dapat pangambahan. Kung hindi naman mataas yung LDLP o yung ApoB, and please watch my video about this. Kung hindi naman yun mataas, no need to worry. Okay? So, kasi LDL can go transiently up, but it may just be the big particles. Hindi naman yun worrisome. Panoorin po natin yung video. Have those LDL subparticles checked. Uric acid, sometimes transiently, can go up, pero not a cause of concern in the long term. It's always going to be good to continue the lifestyle kasi over time, yung uric acid na yan, bababa yan. Okay. Miss Bebe, okay lang ba kumain lagi ng chicharon? Nag-low carb ako 3 months. Okay. Timad. Okay lang po ang chicharon. So, a few things about chicharon. What is it? Protein and fat. Right? Protein and fat. Kung medyo malayo pa ang inyong yung current state ninyo doon sa pinupuntirian yung goal. For example, you still have a lot of weight to lose, yung disease ninyo malala pa, kailangan pa i-reverse, maybe choose a better protein. Pero kung okay naman yung mga yan, chicharon is okay. Okay? Okay lang naman ang chicharon, protein and fat naman yan. Alright? From South Korea, hello po, Miss Rika. Yes, okay. Florentino Encabo, masama pala yun. Nagka-diabetic ako April 2021, nag-diet ako, madalas once a day lang ako kumakain. Last week lang kumain ako ng 2 p.m. Umalis ako mga 1 kilometer, nilakad ko na himatay. Okay, ngayon pakiramdam ko masakit palagi ulo. So sir, may tamang pamamaraan ng paggawa ng low carb, okay? A few different things, guys. Number one, kung kayo ay, let's say, diabetic, meron kayong gamot na iniinom, first, check natin yun. Kasi certain gamot sa diabetic, mga people with diabetes can cause sudden decrease ng sugar. Okay? And that can cause yung pagkahimatay na yan po. Ngayon, kung hindi naman umiinom ng gamot, kailangan gawin natin ang tama. Paano ba? How do you create a proper low-carb plate? Hinahanap ko lang. Ayan. So, join po sa community, sir, Mr. Florentino. Join po tayo sa community. Mahahanap natin ito doon sa community. Paano ba gumawa ng low-carb plate? Kailangan natin ma-meet yung protein requirement, right? Kailangan yan. Proteins and fats are essential. Kahit yung carbs, bawasan na. Pero yan, proteins and fat, kailangan ma-meet. Hanggat meron tayong proteins and fats, hindi tayo hihimatayin. We can make glucose from the raw materials, pero kailangan yung 1 and 2 ma-meet, right? And then 3, low carb, stay within your allowance. 4, check, nutrient dense ba yung meal ninyo? Satisfying ba siya? Low carb ba siya? Okay. So, meron po yan na step-by-step process, sir. Sundan po natin. Okay. Jovelyn, thanks po daw for the info. Me and husband started LCF November 2021. Maganda po ang result. Thanks for all the guidance. Hope ma-meet ka namin. Yeah, so yung mga taga rito po sa Canada, sige, one day, I will let you know. Pag meron tayong event, you can come and meet me. Sige po, magkita-kita tayo. Magkaroon tayo ng low-carb picnic sa park. Sino po ang gusto nun? Mag-low-carb picnic tayo. Kanya-kanyang, mag-sharing lang tayo. Masaya po siguro yun. Sige, planuhin po natin sa summer. Sa ngayon, nasa kasagsagan tayo ng winter. Hindi fun mag-picnic sa mga parks natin. But in the summer, sige, easy po tayo, Miss Jovelyn. Ayan, get in touch po. Join po kayo sa community ko, ma'am. Low Carb Fasting Holistic Wellness. And magplano tayo ng picnic in the park. Low Carb Picnic in the Park. Ayan. Thank you, Miss Rhea. I'm well. Salamat sa pagtanong. Yes, I hope you are doing well din. Yeah. Okay. Miss Chapoy, me again, Doc. I've been on LCF 3 months, 67 to 58 na. Lowered na HbA1c, ESR now 14 from 38. My concern po is about gallbladder polyp. Ano po effect ng low carb? Polyps, normally, over the long term, it can get better. Kasi polyps are just extra growths. Ano yung importante sa mga polyps? Kahit anong klaseng polyps, importante ang follow-up. Some of these polyps can transform into something else. So gallbladder polyp can transform into something more dangerous. Kailangan over time ng pag-measure. So kailangan ultrasound, dapat regular yan. Okay? Any polyp, endometrial polyp, kahit saan yung polyp na yan, colonic polyps, kailangan i-monitor. Kasi nga, minsan nagta-transform. Okay. Miss Joyce, how long does it take para maging fat adapted? Iba-ibang tao, iba't iba ang time frame. Iba't iba kasi tayo ng metabolism. Some people it takes 2 weeks, some people it takes 4 weeks, some people it takes few months. Paano malalaman pag fat adapted na hindi na kayo masyadong gugutumin? Makakapag-TMAD, OMAD na kayo. Okay? Okay, Miss Evelyn Lazaro, good evening. I've been struggling to go back low-carb intermittent fasting. I gained back my old weight due to pandemic. Nawala ako sa focus. Any advice or motivation po on how to continue? Takot din kasi ako mag-IF at baka bumagsak ang immune. That is very contrary, Miss Evelyn. Your immune system will get boosted when you do IF. Okay, so specifically because of this, yung pinakita ko sa inyo kanina, nag-start tayo nitong pag-uusap natin na ito by me telling you how I beat COVID. Paano ko na-beat yung COVID dahil sa pagfa-fasting ko. It prevented this inflammatory cascade. When you are fasting and you go into ketosis, the ketone bodies will boost your immune system. Paano magkaroon ng motivation ulit? Rejoin our groups. Get inspiration from the stories doon ng mga tao who reversed their medical conditions, who transformed their lives, right? Iba't ibang tao, iba't ibang dahilan ng pag-LCIF. Have a very strong why. Bakit mo gustong gawin ito, Miss Evelyn? Is it just for the looks? Is it to reverse a medical condition? May mga anak ka ba? Do you want to be there pag yung mga anak mo ay lumaki na, tumanda na, gusto mo makita mga apo mo? What is your motivation? Why do you want to be healthy? Why? Sa akin, certainly anak ko ang motivation ko. I do it because I want to see my grandkids. It's not for me. I want to see my grandkids. I want to be there. Mag-alaga ng mga apo ko. Gusto ko nandun ako pag, yung anak ko kailangan sa akin. I want to be there. How can I be there if I'm sickly? Right? Buhay ka nga, nakaratay ka naman sa wheelchair. Pabigat ka pa. So, know your why. Okay? So, yun lang po yun. Okay, maybe 2 last and then we'll call it a day, a night for you. Miss Angelita Gumpal, bakit kaya mabagal ako magbawas? 3 months na po ako, 8 kilos lang nawala sa akin. Do not focus on the weight. Focus on how you feel. Every person's different. Look at the strategy that you're doing. Gaano kababa? Alin ba dito ang pinili mo, Miss Angelita? Which one did you choose? Did you go for keto? Did you go for moderate? So kung moderate ka, maybe try keto. Kung keto ka, maybe add fasting. Right? What are the things that can help you lose more weight? Ito. Anything in the green section will cause you to go into more fat burning. So carbohydrate restriction, obviously, intermittent fasting, and then you can add high intensity exercise, and yung favorite ko, muscle building. The more muscles you have, the more you burn energy. Muscle building. Meron tayo niyan, video. YouTube. Pakitingnan po. Okay, again, flash ko for you. Take a screenshot. Paano ka papayat more? Do all these things here, plus add muscle building, pinaka-effective. Okay, there you go. And the last question is, paano gumawa ng electrolytes? Miss Maria Corazon, nasa YouTube po ma'am. Low carb side effects, nandun yung electrolyte solution. Okay, and kita na lang po ulit tayo. Abangan ninyo ang susunod na live. Yung Zoom meet ko parating na ulit. Perhaps sometime either end of this week or next week. Ang ina-encourage ko mag-attend doon, mga walang pambayad sa doktor, please attend doon, public service yon. Yung mga may pambayad na gusto lang umattend, okay lang umattend, pero paunahin natin magtanong yung walang pambayad, okay? Yun lang po. Have a great night, everyone. I'll see you again soon. Lahat ng mga katanungan ninyo, malamang meron ng sagot. Paki-visit po yung YouTube channel ko, Level Up with Dr. Iris. Stay healthy, everyone. Stay low carb.